This film is intended for eye surgeons for training and education purposes. Viewer discretion is strongly recommended.
Welcome back to the next episode of Phaco Follies by the beginner surgeons, and it is aimed for teaching the younger surgeons. Now, in this episode, I'll be demonstrating the struggles of the novice surgeon when they're trying to learn the phaco-chop maneuver. Anonymous trainee surgeon is doing the case, and the surgeon has already performed around 20 cases and is aiming for the first phaco-chop, and the goal is to do the vertical chop. So the steps we all know: we are going to bury the phaco tip into the core of the nucleus, then the second instrument is going to be placed in front of the tip, and then we are going to do the chopping maneuver and the lateral separation maneuver. And let's see what is going wrong here. The surgeon is trying to grip the nucleus, and in the process the tip is gone very much towards the peripheral part. And without getting a complete occlusion and a good hold, the chopping maneuver is attempted, and because there is no hold at all, the chopping maneuver fails. So let us try to break down these steps and try to address each of the issues which the surgeon is facing. Number 1. So why did the phaco-chop maneuver fail in this situation? Simply because the surgeon couldn't establish a good hold on the nucleus before attempting the chop maneuver. So why was the hold not good? Simply because the tip was not buried into the nucleus at all. So if you can closely zoom in and observe, we can see that the tip is barely into the nucleus. It's just scratching the surface. The reason why it is not being buried is simply because the surgeon is probably scared that the tip can go so deep that it could damage the posterior capsule. That phobia would be there. The second would be the concept or the understanding of the three-dimensional picture of the lens anatomy is not being appreciated still. So this phobia is making them averse to going deep and holding it. Just trying to hold the superficial surface, and then if you attempt to crack, it's not going to work. The next mistake which is happening is, why is the burying of the tip not happening? Simply because the angulation at which the tip is attacking the nucleus is not right. It is angled in such a way that it is just going to scrape through the surface. And that's the reason why the surgeon is trying to bury it in the center, but because it is angled in such a way that it's going to slide down, by the time the surgeon is going to get some sort of a hold, the tip is already near the rhexis margin. So the angle of attack is not right. It has to be much more perpendicular. Now, looking at the next case again, look at the angulation of the tip. It is at an acute angle to the surface of the nucleus. By having this angulation, we are unlikely to get any hold on the nucleus. So again, the tip has slid towards the pupillary margin very much near the peripheral part, and we have gone beyond our central safe zone. And as it is expected, the chop is going to fail because there is no hold. The problem again is the tip is just engaging the very superficial part of the nucleus. That's not going to help. We need to hold the nucleus deep down in the core of it. Next case by another surgeon. The two instruments are placed and ready to do the chop. The tip is supposed to be buried. The chopping maneuver is attempted, but there is no chop happening. Again, the reason is simple, that there is no hold. There is no hold because the burying of the tip is not good enough. Now, this is another case wherein horizontal chop is being tried. Again, there is a failure because of two things. Number 1, the hold is not good. And second would be the way the instrument is placed is at an angle. It has to be vertical and then hook the endonucleus, and then it has to be pulled out. Well, the most important issue in this whole series of failed chops by the beginner surgeons was the lack of the surgeon to get a good hold of the nucleus. So imagine if you want to cut a vegetable or an apple, for example, if you're not stabilized or held the object which you want to cut firmly, when the knife goes through it, the apple is going to wobble and you're not going to get a good cut. The same principle should be applied here. You need to stabilize the nucleus properly, hold it properly, then the chopping maneuver works well. So let me demonstrate the vertical chop maneuver in the same case. Now, The machine which I'm using is an Sovereign Compact by Johnson & Johnson. It's my very old machine, but it has got a very big tip, and we can see that we're using a very big tip. And this gives us excellent hold on the nucleus. So the bevel is turned down and slightly to the right. Short burst of phaco is given so that it buries into the substance of the nucleus. The sharp chopper goes in front of it. Chopper goes down vertically, and my right hand is pushed up and laterally. The first crack is made. The nucleus is rotated. The tip is buried again into the substance of the nucleus. You can see the entire span of the tip is buried into the nucleus. The chopper goes down vertically down, and then there is a lateral separation happening. Okay, to summarize, the most important thing for a novice surgeon is to get the concepts right. Okay, so get the basics right. So understand the principle. So the most important prerequisite to achieve a good chop is to get a good hold. So this is the bottom line. And you need to use the right strategy to get a good hold. So in this case, good hold was not being achieved simply because the angle of attack by the tip on the surface of the nucleus was not right. It was more acute, as a result of which only the surface was being held, and that too at the far end of the nucleus, almost near the rhexis margin. The second would be so if you have a more vertical or a more perpendicular approach towards the nucleus, it's more likely that we are going to bury the tip in the center of the nucleus. This is critical. So the angle of attack does make a difference. The second point, the novice surgeon would be very intimidated by trying to bury the tip simply because they're so scared that they can go through and through to the posterior capsule. So you need to understand that the lens thickness is, although it's variable, the lens thickness is quite large enough for us to bury your 1.5 millimeter exposed tip. It's unlikely that the tip is going to go through and through. So only in extremely young patients who got very thin lenses and soft lenses, that can be an issue. For most people who are having age-related cataracts, your exposed tip is about 1.5 millimeter. It's not going to be a problem. The amount of tip which has to be buried into the nucleus depends upon the density of the nucleus. If you're dealing with a denser nucleus, I would like to bury the entire exposed tip into the substance of the nucleus. On the contrary, if you're dealing with a very soft nucleus, maybe just 50% of the tip buried into the nucleus could suffice to get a good hold. Either way, you need to ensure that at least more than 1/4 of the tip is into the substance of the nucleus. That would ensure a good hold. And once the hold is good, your chopping maneuvers are going to be very consistent. So that was it. Thank you for watching, and hope you found this helpful.